Hello, my name is Dr. Laura Lai, and I am a psychiatrist at Children's Hospital of Orange County, and I work mainly with the intensive outpatient program. I'm here to talk with you about mindfulness. This will be an introduction to what mindfulness is and what it is not. Mindfulness is the act of being in this single present moment. It sounds easy, but it can be challenging. It's the opposite of multitasking, which is what most of us do all the time without even thinking about it. And so, because that's what we're used to, we really have to train our minds to only think about this single present moment. When people think about mindfulness, sometimes they think it is a blank mind, free from all thoughts. But that's not really the case, which is a good thing because that is actually really challenging to do. Even if you're sitting there thinking, I am going to think about nothing, you are thinking about nothing. So you cannot truly have a blank mind. Mindfulness is also not about feeling calm, cool, and collected. You might have a vision of calm, silent meditation like you've seen in shows or movies, but that's not exactly it. Let's talk a little bit about why. Mindfulness is a complete focus on what is happening right now. No past, no future, no anticipating. You can notice the way you feel, your thoughts, or your environment, but you avoid interjecting with other thoughts like, oh my gosh, this was horrible, it's going to be horrible again, or even thinking about, oh, this is going to be so wonderful too. Mindfulness is helpful when we become so focused on our past or future that we become stuck. If you feel stuck in the past or future, mindfulness can keep you grounded in the present. Mindfulness is also helpful if you can't stop worrying about something. Usually when we're worrying about something that already happened, happening again, or something that's to come and thinking it'll be terrible. So mindfulness helps us to push the worries out of our mind for a little bit. Mindfulness gives us a pause, which is really important. Because sometimes taking that pause or that break is what your brain needs to get unstuck or to have a different perspective on what's going on. Sometimes that can be just what you need to go from worrying to problem solving. There are a lot of benefits to mindfulness, including improved attention and memory, improved sleep, improved relationships, and calmer emotions. It can also lead to less worrying or unhelpful thinking, lower anxiety, lower stress, and decreased depression. In some studies, mindfulness has even been as effective as medications when used daily, which is really cool for me as a psychiatrist to have non-medication options to give people. So we're going to try a little snippet of mindfulness practice, and then in future videos, we'll get a little bit deeper. Let's start with a simple mindfulness practice. This one follows a pattern of 5-4-3-2-1, so it's easy to remember how to do it when you need it. So, number 5, name 5 things that you can see from where you are. Name 4 things around you that are green. Depending on where you are, you might have to look very closely. Name 3 things around you that have a circle on them or are round. Name 2 sounds that you can hear. And lastly, name 1 thing around you that starts with the letter R. I like this practice because you can literally do it anywhere. You just notice the things that are in your environment. For some of us, it was easy, and for some of us, it might feel hard. Like I said, mindfulness takes a lot of training. If you get distracted, try not to tell yourself, oh, I am so terrible at this. Instead, be non-judgmental. Simply notice, you got distracted. That's how you were feeling. And try again. And that is mindfulness too. And there you have it. You've already done a minute of mindfulness. Every time you practice, you'll get better and better. So I'll see you a little bit later for the practice video. You got this.